Good morning. I'm Mark Goldstein. I'm the president of AJH Hospital. I want to first start by thanking all of you for choosing AJH Hospital. When you come to AJH Hospital and get a chance to see our facility, you'll be so impressed with the quality of service and the quality of individuals that we've brought in and hired over a long period of time. When you reach your departments, I'm going to encourage each of you to look to the staff, find out how long they've worked here, and listen to them about what it is like to work at AJH Hospital. I've been here 16 years. I'm in my 16th year at AJH. I live in Newburyport. My wife and I met in college. We've been married for now 35 years, and I have two daughters. One daughter is in healthcare, and my other daughter is a school teacher. Actually, now she's a principal. So I have a terrific day planned for you guys today. You will meet our entire management team virtually. I so much look forward to the opportunity to get to see you in your departments and find a way to meet each of you individually. Unfortunately, because of COVID, this is our new way, our new model. We're pivoting, we're adapting. It's been almost 335 days really since we've started with COVID. It's hard to believe we're coming up on the 1-year anniversary, which for us was March 16th. What I want to do today is give you a high-level view of some important factors. But really, after you go through all of these videos and slide decks today, the one thing that I really want to make sure you get out of the day is that you feel safe and that you keep our patients safe. There's nothing more important than the role that you have, regardless if you're working in our nursing unit or if you're someone that has selected the laboratory, even if you're in any other offsite building in this hospital enterprise. I want to make sure that you feel safe and that you keep our patients safe. If you find yourself in a situation where you're not comfortable doing what someone asks, or if you aren't sure of what to do, just pause for a minute, talk to a supervisor, report whatever you feel is an inequity that's being asked of you so that we can keep our patients safe. What I want to start off with is a mission statement. And for AJH Hospital, we've spent a lot of time over the years developing and really tweaking our mission statement, but it really goes back to the very beginning. Our goal is to provide the highest quality medical care and improve the health of our community, and we want to do that in partnership with our medical staff. Our values, you'll see on this slide deck, are really built around the patient and patient safety. There's nothing more important. If we're a high quality organization and we're thinking about safety and we're compassionate in what we do, and we keeping track of our effectiveness and our financial resources, what it does is it will allow us to care for more patients in a way that will improve the health of our community. Recently, we've joined Beth Israel Lahey Health. You'll hear about that in this day today, and you'll see some videos about it. And I want to encourage you to think a little bit about AJH Hospital as part of a larger system and network. But to think about that, you really have to go back to the very beginnings because our history is so rich. And I'm going to encourage each of you to learn about our history. As you're walking the hospital, you'll see it plastered all over the walls. Our hospital was started in 1884. Interestingly enough, we're one of the oldest hospitals in our Beth Israel Lahey Health system and in Massachusetts. It was started with the vision of Anna, who sits in the lobby of our hospital with a write-up. When you look across from my office, which is next to the gift shop, you'll see a letter that Anna wrote to the physicians in the community, Dr. Howe. And what she wanted to do is she wanted to compassionately care for her community. And our hospital picture that you see here is on Broad Street, and that hospital building was relocated, and it's the front of the hospital today on 25 Highland Ave. We're a 123-bed full-service community hospital. Our campus, our growing campus, is about 300,000 square feet. What differentiates Anna Jake's from most hospital is we have private rooms for all of our patients. We have 73 medical surgical private rooms. We have an adult and pediatric psych unit, 20-bed adult unit in Newburyport, and we have a 13-bed pediatric psych unit in Amesbury. We deliver about 700 babies, and our birth center is 12 private rooms. We have neonatologists caring for our sickest babies in our neonatal care unit, and we have 6 operating rooms. You'll also hear about an expansion plan that we have where we're going to be adding 2 new operating rooms and reconfiguring the front entrance of the hospital. We also do procedures, ambulatory procedures, and 5 state-of-the-art procedure rooms, and our emergency department is a level 3 trauma center. Our workforce, which you now all have joined, is 1,200 employees. We have 300 registered nurses, approximately 200 physicians on staff here at the hospital. And pre-COVID, we had over 200 volunteers working throughout the hospital. I'm so looking forward to seeing them back in the hospital. Some of them have come back in the last month or 2. In total, we do about 10,000 overnight stays in the hospital and around 5,000 surgeries. Our emergency room sees around 31,000 patients every year. And historically, our hospital has run about a break-even to 1% operating margin. I think you'll hear now and get to play our new video on our operating room and front entryway. And as I leave you today to the rest of the team that you'll meet, I'm so excited that you've selected Anna Jake's Hospital. And I also want to remind you again from my opening about safety and the importance of it. Throughout the day, in our hospital, we tell safety stories. And these stories are so entwined in our culture because we can learn from them. So always, no matter what you do, put safety and our patients first. Thank you for joining us and enjoy your day today.